Hi, everybody, and welcome to episode 58 of the Pet Behaviour Chat. And I'm so excited for this episode because I have my wonderful colleague and friend, Dr. Hannah Capon from Canine Arthritis Management, which is a UK-based company that focuses on arthritis, pain, everything to do with that. And Hannah and I have had so many really, really great conversations around pain and behavior and how the two are interconnected and you can't really separate them from each other. So I'm excited to get into that a little bit more. But before we do that, I would absolutely love you, Hannah, to give us a bit of an overview of CAM, how it came about. You're the mastermind and the founder, obviously, behind CAM. So yeah, just tell us a little bit the story of how you got where you are now.
Thank you. Well, it's a real honour to be here, but it is kind of like batting both sides because you've just come out on our podcast, Canine Arthritis Matters. I don't know if you know, but me and Kristen Kirkby Shaw have just reviewed the interview that I did with you a few years back, and it's so evergreen. You know, what we talk about is just undeniably powerful. So yeah. We're supporting each other, scratching each other's backs. So yeah, I'm a vet based in the UK. I'm a first opinion practitioner, and I'm proud of that. I know that sounds daft, but the world is changing, and to be a first opinion practitioner is getting quite difficult. It doesn't seem to have the kudos that it once had, but I'm going to be there saying, "Hey, first opinion practitioners, we're amazing." So yes, I'm a first opinion practitioner. I do a lot of locuming. I move around the country. I was once called Flitty because I change practices quite a lot. That was in an interview. Somebody actually said, "You're quite Flitty." But that did lead to the creation of CAM. That was definitely an element giving me confidence that something that I was seeing in all practices that I was working at was a real lack of attention to what I believed at the time was a real concern, and I'm really glad to say about 4 years later, the evidence to support that belief came out through Professor Daniel O'Neill's work with Vet Compass, that arthritis is a small animal welfare concern. It is a leading cause of elective euthanasia. It is a condition we see in first opinion practice that causes the longest amount of suffering. Mm-hmm. And thank you, Professor Daniel O'Neill, because otherwise it looked like I've been lying for years, going, "Come on, guys, listen to me." So when that came out in 2018, I was like, "God, thank God, thank God." I've got something I can actually use to back up what I'm saying. But no, canine arthritis management was it was an accident. It was a complete accident. It continues to maintain itself, accidentally bouncing from one thing to the next. And it's like turning stones, trying to find things. If we turn enough stones, we'll eventually find, where we're heading. But our key ambitions is thinking about your everyday, dog caregiver, the people that love their dogs. They potentially are budget restricted, be it financially, be it time, but they love their dogs and they want to do the best for them. So it's an online community where we try and help people identify the signs early, understand the disease, understand how to get the diagnosis, how to manage the disease appropriately within their budgets, and also what services that they can expect, how to use them appropriately. So it's a kind of big comfy arthritic jumper. We try and look after people. That's our plan.
Yeah, that sounds amazing. And you've actually had firsthand experience, haven't you, with living with arthritic pets? I think one of your doggies was as much of an inspiration for Cam as much as Cam was an accident. I don't believe Cam was an accident.
Well, you better believe it, because it so was. It started off as a Facebook page. It started off because I was doing a mobile service, and I knew what I wanted to do. I couldn't achieve in practice. I couldn't do it in 15 minutes, and I couldn't do it with all the obstacles to practice life. And obstacles could include the premises, it could include the time, it could include colleagues. And I was feeling very hurt, frustrated, annoyed. So I started a service where during the weekends and evenings I'd go to people's houses and I'd try and use my veterinary knowledge and kind of bring together lots of different elements, and I just found it worked brilliantly. And that's where the hashtag #YourDogMoreYears comes from, because these cases were just they were just doing so much better than what I could achieve in practice. So, but then when I was doing that, I was realizing I was focusing, at least 4 hours per case, because by the time you've driven there, you've spent time with them, you've written your report, and you're like, 4 hours, one dog. What if I record this? What if I take photos? What if I put them online? Could I help 10 dogs in 4 hours? Or could I help 400 dogs in 4 hours? So I set up a Facebook page with the hope that what I was learning and was being reinforced could be spread and more people could benefit. And it just went crazy. So it was an accident. There you go. But yeah, so one of the motivators was Holly. Yeah, one of the
Holly. Sorry, I keep getting her name wrong. Luna's the dog you've got now.
Luna's the dog I got now. So
right,
there was
Holly's. And that's why it's Holly's Army. Got it. Holly's
that's
the original one. Yeah.
Yes, Holly inspired the community group called Holly's Army, which has now got nearly 18,000 caregivers in there, self-supporting each other, which is it's a beautiful place. And I must acknowledge the ambassadors that manage that group. I don't want to use the word police it because that's too negative but they basically make sure that it's a kind place and people look after each other, because some of these forums can be quite cutthroat. So Holly, definitely I learnt everything from making all of the mistakes with my own dog and realizing that the resources that I needed to do the best job for the one that I adored, I loved more than anything, were not there for me. So I wanted to make sure that I could look at what I'd needed and provide it for others.
Yeah, that's amazing. And you've already touched on a couple of points that are so synergistic between the work that you do and the work that we do as behaviorists. I think the one thing is that you mentioned earlier on is, that idea that the caregivers absolutely love their pets and, they want to do the absolute best for them, but they're restricted perhaps, by a number of things, whether that's environment or maybe family members or maybe finances or maybe just access to support, professional support and education. And I feel, the same way. I think, there's not enough out there for caregivers around behavior, just how you found it to have been around arthritis and chronic pain. So I think that's definitely a synergy. And then also the time that goes into these cases, because, they're not your 15 or 20 minute cases. They're not a vaccine or an ear infection, even though that can also take longer. But, the hours that we spend with these patients, I mean, my veterinary, the behavior consults are minimum of 2 hours. Then you read, all the questionnaires beforehand, go through all the videos, write the reports afterwards. So I totally agree with you. And that is on the one side, from a business point of view, can be challenging. But on the other side, the relationships that you build with the caregivers and with the pets, because you get to spend that time with them, is not how I remember it being when I was working solely first opinion. And I am also a first opinion vet at heart. I've been a GP vet for most of my career, but there is a definite difference in the relationships that you're able to build with caregivers when you have that longer period of time.
Oh yeah, 100%. And I wouldn't change it for the world. I think it's something that we have to be aware of, how much you suddenly find that you've invested and you start realizing you're drifting into that deep, dark cavern of caregiver burden, which would be lovely to have a brief kind of interlude and talk about, because I don't think people appreciate how much of ourselves we put into the work that we do. But no, it's a different experience. And what I would really like in my lifetime, I'm running out of time, Katrin. I'm running out of time. I need more.
No, you're not.
I am. I'm 46. I just want to start all over again. But I've just got this daydream that, we actually break chronic disease away from acute disease management. And we have almost there's going to be a subspeciality, and it's going to be a distinct part of every practice where the rooms are going to be bigger. They're going to be equipped for these animals that need our care. They're going to be lit differently. They're going to have a different vibe. There's going to be more time. There's not going to be the pressures outside the door. And I just think, what a wonderful place would it be? You've got all these techie hospitals that are popping up, but they have a little bungalow next door with its own private driveway. It's got its own little front garden. It's got a little living room, waiting room area. And it's a different experience, because I'm going to be outrageous. I don't think chronic disease can be managed well in the environment that we are creating for efficient, effective vet care. Is that fair?
I think that's 100% fair. And what you've just described, the little bungalow with a front garden, is exactly what I put into the backyard at GVC. It's called our Behaviour HQ, which is its own little porter cabin type. It's not really, but it's a purpose-built little bungalowy type, cabiny type building that we put into our back garden essentially, and all our behaviour patients come in there. Nobody has to walk into the main practice. And it's exactly as you describe, a separate
That's
waiting
exactly
area.
what I want to do. I'm still trying to find my fairy godfather. So if anybody is a fairy godfather listening today, let's just get in touch. But yeah, I just want to buy a little, as I say, bungalow, and the whole area that the dog experiences is inviting and it's friendly. And I think the vet profession are coming around to the idea that the current model that we have doesn't necessarily meet the needs of the patients that we see, not all of the patients that we see. And I'm hoping that there's room for innovation that isn't just focused on time efficiency and financial efficiency and staff efficiency, and it actually thinks about need.
Yeah, no, absolutely. And I think being able to provide that care is going to become more and more important as our dogs are getting older. I think as caregivers get more educated, as caregivers are perhaps getting a little bit more demanding of what they'd like to see and what they'd like to experience and how they'd like their pets to feel and how they'd like to feel in a veterinary setting. I think that is becoming a little bit more accessible. I think here in the UAE, we're probably the only practice that maybe think in that way, but at least we're one in a country that's perhaps not as well known for its vet care as the UK, for example. So I think we're getting there slowly but surely.
Yeah, but you're a front runner. You're a leader. You're a pioneer. That must be quite an exciting feeling.
It is and it isn't, and I say it isn't because I'm not sure that everybody understands what we do all of the time. Yeah, I asked a question on social media today, which was, directed at vets, what's one thing that you'd like to learn more about in regard to veterinary behavior medicine? And one vet came back to me and said nothing. And I said,
oh my God. Oh my God. Can I tell you my story, which really, so I went to a job interview, and it was a big practice, and I'm obviously obsessed about chronic pain. I'm very focused on the caregiver needs as well as the animal needs, and I think there is a lot more to it, and we're not talking about simple. We're talking about complex conversations. We're talking about behavior change. We're talking about things that need you to really concentrate, dig deep to get the results that you need for the care of the animal. And one of the vets that I walked past, he was like, oh, so how does this chronic pain work then? What, you see them and then you just pass them on to somebody else, do you? And I was like, no, I don't actually. I was like, oh my God. It's called continuity of care.
Who are you supposed to pass them on to?
Anybody bar me. But no, I was just like, no, this is the continuity. It's about allowing the caregiver to learn that they can talk to you and allow all of the things that you need to know to make a difference to come out, and also that animal, be it cat or dog, the repeated visits, you get more and more information and you pick up on these little tiny things that can make the biggest amount of changes.
Yeah, absolutely. So I'm going to do a little bit of a spoiler alert very quickly, because actually what you've just said has made me think about something, an idea that came to me whilst I was in the Maldives last week. What a perfect place to have ideas come to you. So in 2013, I actually did a coaching qualification. So like a life coaching type qualification. I actually made use of a coach in that period. I was going through a bit of a rough period and I had a coach and it helped me so much and I was fascinated by it. So I did a course in coaching and I got the qualification, and it's been lying dormant probably for the last 10 years since 2013. And in the Maldives, all of a sudden, I was just kind of lying, looking up into the wonderful blue sky. And I thought to myself, hang on a minute, I need to resurrect this coaching thing, because that's exactly the conversations that we need to have with our caregivers to really understand what's driving them, or is not driving them or is blocking them, to be able to make a bigger difference, I think, to the patients. So that's my little spoiler alert. Coming in 2025 is I'm going to be reviving that and bringing that into my veterinary behavior work, so that I have a much stronger element of that when I'm actually doing consultations and I'm actually
I think that's so important. And I definitely am more intrigued by consultations. The older I get, the more years that I've been a vet, 22 years being a vet. And I look at each of these like 15-minute opportunities of how am I going to get that person in front of me to be on the same journey that I'm on? How can I take them with me? And how can I make sure that when they leave the room, I've changed something, I've influenced. They're going to go away and think about it. And, you know, being able to still be passionate about every 15 minutes, I think is something I'm quite lucky. I'm very fortunate. But there is a huge element in what we do, which is coaching. You know, I think we're not the paternalistic dictators. You know, we can't just go do this, see you in a week. We've got to say, I'd really like us to do this. How can we do this, and how can you maintain this? And that's definitely more of a coaching role.
Absolutely. And I had periods throughout my residency where I definitely was more like, look, just do this, you know, take these meds, do this, and things will get better. And it didn't work.
No.
You know, I went through a spate of cases throughout my residency. I don't know, maybe somewhere around the 100 to 120, you know, where I was probably tired. You know, I just wanted to have people, you know, look, I know what I'm doing. Please do as I say. And it just doesn't work. So you definitely need to dig deeper and get, you know, further behind actually what's going on, and what's at the heart of some of these emotions around behavior and behavior change and what's happening with the pet and within the family.
So there's a really good model, and I have this play in my head quite a lot. There's a couple of things. So there's the COM-B model. I don't know if you've heard of it, which I have in my head during every 15 minutes is capability, opportunity, motivation for the behavior change. So I'm looking at, have they got the capability? Are we got the opportunity? And is that person leaving the room motivated to do what I said? And it's a kind of a little thing you do, COM-B. And the other one is Bran, and this was from Zoe Belshaw. Whenever you're coming up with a plan, what's the benefits? What's the risks? Is there an alternative? And what if I do nothing? And those two things I have in my head quite often, thinking, you know, what am I doing to make sure that this has the best chance of working? And I think that comes back from the fact that I've done a little bit of reading around getting people to engage with long-term plans. That's really different to a 7-day course of antibiotics. You know, when you're talking about lifelong illness and how you can get somebody to engage with their needs or their, you know, their patient's needs and maintain a plan. And I read this paper from physiotherapists, so human physiotherapists, and something like only 50% of people go back for the second physio appointment. And you know, the actual likelihood that anybody will maintain that targeted exercise plan is like 10%, something ridiculous. And when you look at, we're not alone, this is all service providers, medical service providers, of trying to get people to embrace what you said, understand it, engage with it, and maintain it. That's tough. That's really, really tough. And then that springboards me into, this is me going on a rant, here we go. I think the discipline I'm in at the moment is amazing. You know, it's changing. It's just phenomenal. You know, all the advancements in not only diagnosis, but also the management strategies, amazing. But there is still a very big lack of, are we actually getting them to do what we know now? I know it's really exciting what we're going to know tomorrow or the day after, but how are we doing with getting them to do what we asked for today with the things that we've got? Because we've got an amazing toolbox already. And I read a paper that was dividing OA in the human sector into the disease and the illness. And I think currently in the vet sector, we're very good at focusing on the disease. And I think people are searching for the holy grail of how to cure the disease, you know, and manage that. But the illness, the consequences of pain, is not very well managed. And that takes time, it takes energy, and it takes a lot of behavior change to get all the secondary illness under control. And I'm quite happy saying that's, I think, where I'm really quite interested.
Yeah, I mean, absolutely.
I've gone on a little tangent there, didn't I?
Well, no, because no. I think like super interesting. And I hadn't actually thought about it like that before. And that was pause for thought that I was doing just then, because yeah, you're right. It's those secondary things, it's the fallout from, and the adjuncts, and the everyday things that need to be managed, that I think become wearing, and there is that wear and tear on the caregivers, which segues us nicely into talking about caregiver burden, whether that's us as veterinary professionals or whether that's the pet owners who are the actual caregivers of those pets. So I'd love to hear your thoughts around that.
Oh my God, gets emotional. I'm going to use the opportunity to just say there's something in the CAM member zone all about the emotional burden of caring for one that you love, be them human or be them animal. But I think we underestimate how emotional it is looking after a pet or a family member or a friend. And let's do the professional first. I know many people that work in the chronic disease sector, and they have to be very, very aware of how much of themselves they're losing. And luckily for some, they've identified what their signs of, I'm going too far, I need to back off, I need to get some me time. But there's many people that are new to this area that do get burnout. And burnout's not a nice place. Have you ever had it?
That's what happened to me in 2013 when I then had the coaching. So yeah, that was after setting up the practice and the overwhelm of that. And I think also to do with caregiver burden at that point, because I was the only vet working nights and days in my own practice at that time. So yes, I'm very familiar with burnout, and it's not nice.
It's not nice. And I think I'm just going to take the opportunity to describe it a little bit, because I think some people can just categorize and go, oh, burnout, right, all right, thank you very much. But so when I got it, I lost the ability to make decisions. I couldn't decide. I'd go into the supermarket, I couldn't pick something off the shelf. I was supposed to go away for the weekend. I was supposed to fly for a weekend away, and I couldn't even pack the bag. I wasn't a pleasant person to be around. I didn't have anything nice to say about anything. I found just everything tough. Everything was really tough. And I'm a person that loves life. I love morning walks, but I wanted to stay in bed. I was waiting for the sun to go down so I could get back into bed and just not have to deal with shit. And I think people underestimate how bad it can be, and our profession is very, very prone to it, aren't they?
Absolutely. So what you've just described there, that whole thing about just waiting for evening to fall to be able to get back into bed, that was me as well. Absolutely. And I don't think I was a particularly pleasant person to be around, and I went into avoidance. I would just run away from things, not deal with problems, let other people sort things out, because I just didn't have the capacity to deal with it anymore. The other thing that happened to me is I couldn't do euthanasias anymore. There was one particular day, that I had a little street cat was brought in, friendliest little chap, hopped out of his carrier, rubbed himself up against me, looked horrendous, in horrendous physical condition. We did an FIV test. He was FIV positive, and I knew that I would have to euthanize this cat. And there he was, rubbing up against me, looking into my eyes, happy as could be. And I just said, I can't do it. Somebody else is going to have to do it. I can't. And that was the first time in my entire career that I'd ever not been able to do a veterinary task. And especially euthanasias. I always prided myself on my euthanasias. So that was tough, and it took a little while until I felt ready to do that again. But that was in that time as well, 2012, 2013, that was 4 or 5 years after opening my practice, and it just got a bit too much. So
yeah. Oh, I totally get it. And now let's flip the coin and look at the caregiver at home. And they do not have a break from the needs of their
That's
pet.
Right. Yeah.
And they also will probably struggle to know what those needs are. So even when you meet the needs, you still don't think you've met the needs. So therefore, you're permanently berating yourself. I know with Holly, having first-hand experience of just getting all consumed for her every possible wish, being there to carry her up and down stairs, help her in and out of bed, take her to the toilet, short walks, all the money that I spent. I was just spending money on anything. I was trying everything. I didn't go out. I stopped going on holiday. I wouldn't go and see my friends. Yeah.
Yeah.
And I see it a lot. And I have to just tell you this story because I'll always remember reading it. It was one Christmas on Holly's Army, and this is why Holly's Army is a special place for me. And we're trying to get Holly's Army into the member zone to keep people even more safe with more resources. But this young girl wrote on Holly's Army one Christmas day, I'm up in my bedroom, I'm sobbing my heart out. I've got all the family around, and I've just come downstairs to find one of my family members throwing a ball across the slippery kitchen floor and seeing my dog splay leg, my 16-year-old terrier, sliding across the floor out of control, and I lost my rag. I lost it on Christmas Day with the whole family, and I'm now upstairs sobbing. And you're like, yeah, I get that. I totally get that. I could actually see myself doing that.
Yeah.
So I do feel that chronic disease needs a different kind of management. I understand it doesn't fit into our current veterinary model. I do think we need to start thinking outside the box how we can deliver. I wonder whether, this surge towards telehealth. Yeah, I've got to tell you something really funny. I thought about this the other day. I just wanted to know what you think about this. So now that we've got telehealth and we've got this availability 24/7, why are the consults 15 minutes? What's that about?
Yeah, that's true, actually. What an opportunity.
Yeah.
Missed opportunity.
Come on, tele people, think about
this.
Yeah,
think about it.
You've got rid of a lot of the overhead. You haven't got the room, the lighting, the staff, all the prescription.
Yeah.
This is our opportunity to offer longer time.
Yeah.
There you go.
Yeah, no, totally agree with you. Yeah. And, and again, I think, so just flipping back again to the, what the story you just described about the girl at Christmas who, saw her 16-year-old terrier sliding across the floor. It's the same with behavior. And, what you had mentioned about you're there, catering to every wish and whim of the pet. And it's the same in behavior. I think about those clients that have dogs with separation anxiety that literally can't leave the house. They have to completely change their whole lives around to accommodate their dogs. And a lot of them do it happily, gladly, because they know that that's what their dog needs. But there comes a point, when they can't go on holiday, they can't, just nip out to the shops quickly, where that starts to become a real burden. And that's where I see it, in terms of caregiver burden. And then the same thing, a visitor comes, fearful dog visitor comes in, and, they've been instructed not to pet the dog. And then, of course, they know better. I know dogs. I've had dogs all my life. The dog's going to be fine with me. So yeah. There are so many parallels here. And of course, it would be like that, because just like chronic pain, behavior is also a chronic disease that can only be managed, that can never be cured. In most cases, behavior problems, unless they have, an obvious underlying physical health or physical medical disease. Although if that's chronic pain, then we're back to square one. We're back in the same situation again. Mm-hmm. So there's so much overlap. There's so much synergy between what you do, chronic pain, and what I do, behavior. It's quite uncanny how alike they are. And the problems that we struggle with are the same as well. If we think back to the traditional model of what veterinary practice looks like, or what people think that should look like, and we need to move away from that, I think.
We do. We really do. We need to have a little bit of a brainstorm of how we can meet all stakeholders' needs to provide the service that actually leads to change,
Yeah.
But I know that, because I don't know, do you know we do a teleguidance service now?
Cam? Yeah. But tell us a bit about it. Yeah. Tell all the listeners all about it.
So basically, when Cam set up 2013, whatever it was, I was having lots and lots of people message me via Facebook, email, whatever, asking for advice. And because of Royal College rules, it was, I can only offer a generic. I'm not your actual lead practitioner. Your animal's not under my care. And that's how Holly's Army started, because we were inundated with messages from people saying, help me, help me, help me. So we created the group so that people could post their story, because that's one way to start the ball rolling for change, is letting people actually talk about where they're struggling. So then Holly's Army kind of blossomed, but still carried on getting lots and lots of messages and people asking specifics that couldn't necessarily be answered in a group manner. So I took the bit between my teeth and decided to set up a tele-guidance service. So we don't plan to prescribe, we plan to work with the first opinion practitioner, doing something that they can't do, provide time. We can provide that time. And it's called a limited service provider. It's recognised by the Royal Vet College, so it's all above board. It's all, insurance, public liability, blah, 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 blah. And the service at the moment is hosted by me, Dr. James Hunt, Dr. Katie Smithers, and the amazing Evie Tuman. And between us, we've got quite a wide array of knowledge and skills. And we can offer not only the veterinary consults, but we can do veterinary nursing consults, and we can also do something called discovery calls. So people can have 10 minutes with Evie to just pick the bones a little bit and go, can we be of support to you? I know that it will eventually roll, and it will be rolling down the hill really quickly. But at the moment, there's still a lot of obstacles to people's opinion of what it can achieve, because there's still that real feeling you need to touch my animal to make a difference. And I think from the behavior aspects that there are many occasions that you do not need to touch that animal. You can see a lot from videos and photos. And I know from 22 years of being a vet, I spend most of my time coaching the caregiver and taking the animal and the lighting and the small room and the table and the slippery floor and everybody else around me out and having my time with that caregiver for an hour, no interruptions. I get much better results. So it's been running for a little bit now. It's, as I say, it's a project. It's a project.
No, it's great. And we do something similar. So we do vet to vet consults, and we do also vet to trainer consults. So just today, actually, I had a consult with a trainer from the UK who has a case that needs behavior medication. And the vet in the UK was just like, I know nothing about behavior meds. Very happy for you to go and do a consult with myself. And then, act on my recommendation. So again, it still stays in the hands of the primary veterinarian, which is great. But it requires them to be on board and, to kind of buy into that sort of way of collaborating and working together. And I think in this instance, it's going to be great for the little dog because, he really needed or needs some help. So, we do something similar. So we do vet to vet, vet to trainer, vet to other pet care professional if needed. And I feel the same as you. I think this is going to just, get more and more popular. And just having, being able to provide that support. And they're actually my favorite things to do because I love supporting the profession as well as the caregiver and the patient all at the same time. You get such a, big bang for your buck in that case because everybody feels supported, which I love.
Yeah. And I think that's something worth talking about as well, isn't it? That as small animal medicine, as veterinary medicine continues to grow in what we know, what we understand, what we can do, it is impossible. It is absolutely impossible to be an expert at everything. And the more I learn about chronic pain, the more I realise I know nothing. I know nothing. So we as a profession are quite happy to refer to referral centres. And so if we have a cardiac case, if we have surgery, if we have an emergency, I think we're slowly taking on board that there are other things that need referral. I think rehab's coming in quite strong now. I think behaviour is coming in quite strong. But also being able to say, I can't give this the time. It's not that I'm not capable. But this is a complex condition, not just because of the disease being complex, but because of the caregiver understanding and needs. I'm happy to let somebody do a lot of the legwork for me because I'm really busy. I'm really tied up. But I don't want to lose that case because that person is part of this practice. And so I think there's a chance that a lot of these support services that do not see themselves as competition for a practice, for their structure, for their services, for their, let's say, turnover, I think there's a lot of synergy there because we have got massive team shortages here in the UK now, and we've got really big changes in the way that veterinary professionals wish to work. There's less of it being, that vocation. I'm happy to arrive at 7 and leave at 11. That's gone. People are like,
Oh, yeah.
actually, we need to have a life. So if we are going to serve the needs of our team and we want to keep our practices, offering the services for our clients, is there a way that we can use these support services? Everybody's talking about AI, everybody's talking about all these apps, everybody's talking about all these other kind of subsidiaries that you can bring in as a support system. But what also about the person at the end of the phone? Could there be external services that you could use and you don't lose case control?
Yeah, absolutely. And I think you're so right when you say, that there doesn't need to be competition here, right? That we're providing a unique skill, knowledge set that we've acquired because we've dedicated some time to that, and being able to just kind of provide that but not take anything else. I think that has to be the way forward, because that's kind of the sort of true definition of that collaborative approach, is that everybody brings their little piece of expertise into the mix, and then all of a sudden the puzzle pieces start coming together and you start seeing successful outcomes. And I think if we truly look at it like that, nobody's trying to take anything away from each other. Actually, it's the complete opposite. We're trying to give and enhance and learn from each other. At the end of the day, it's about the patient outcome for most of us. I think
100%.
pretty much all of us, right?
And so in the human sector, chronic pain is ideally managed in that way, where a lot of time, a lot of interdisciplinary skills, and I'm doing a master's, and it'll be amazing. Spend weeks on a very, very tiny topic about human behaviour change. And I think about what we do in the vet sector. It's, as you say, here's medication. I'll see you in 6 weeks, and I'm like, oh my god, there's so much here that we could do. But the current situation, it's not that time availability isn't in practice. So if we want to provide these services that people need to get their adherence to our management plans, maybe we do need to look slightly outside.
Yeah, no, totally agree. I know it's one thing that we wanted to chat about a little bit was kind of the importance of that collaborative approach. And I think for me, that's something that as I've gone through the residency and as I've started seeing these more complex cases, you kind of think, well, this is my case. But even there, hang on a minute, there's something here, whether that's a chronic pain piece or a rehab piece or a physio piece, or it's a medicine piece. There's so much internal medicine that goes into behavior, where I'm like, okay, this is now where I need to get the help of an internist or a rehab person or a chronic pain specialist to help me enhance, my patient outcomes. So I think that collaborative piece is something that I've grown more into, and that hasn't been easy, because here in the UAE there's a very competitive approach, and it's really very kind of, this is mine and everybody sort of stay away approach, which is very sad, but that's traditionally been how it has been here in the last 15 years, certainly. But actually that's changing in my mind so much, and I'm much more keen to, almost desperate to collaborate with, other professionals that are in the region, or maybe not in the region, but whoever can provide that little piece of the puzzle for me that I need to make my patient that bit better, and the caregiver outcome that much better as well.
Yeah. Oh God. And that's very, very prevalent in the chronic pain sector, because there are actually so many people that are needed to manage a case well, so you've got the veterinarian, maybe the clinical lead, then you've got maybe an orthopedic surgeon, you maybe have got a pain specialist, you've got a rehabilitator, you've got a behavior medicine clinician, you've got so many people. But then you've got all the canine professionals. It might be a dog walker, it might be the groomer, it might be the kennels. There's so many people involved, and as you say, trying to have a team approach, which means I can actually hijack that point, #1team, about the chronic pain symposium. Can I?
Oh, yes.
Didn't even talk about this one, did we? So we did the chronic pain symposium in 2024, and again, it was kind of more of an accident, but it went really well. Yay!
It was great, wasn't it? It was really great. Yeah.
Do you know, somebody described it as band camp, like behind the scenes, backstage, it was like band camp. And I was like, I love that. I'm going to use that. But the mood was great. It was frenetic. It was crazy. It's back in 2025. Again, #1team. It is about providing knowledge to all stakeholders, so canine professionals, veterinary professionals, please come join us. We had 6,000 attendees last year, which is not bad for first time
Very
occasion.
cool.
We're pushing for 12,000. That's
Oh,
I know, we're like,
blimey.
come on, bring it on.
Yeah.
So yeah, it's last weekend in April. It's a 4-day event. We've got incredible speakers, a mind-blowing array of speakers, and yet again, it's free to attend. So
Oh my God.
I know, right? I know. It's really important to me. And I think you'll be able to relate to this. When I had my light bulbs about chronic pain go off, I found that I didn't have a network around me that understood or saw what I saw, and I felt very lonely, and I felt I didn't really know who to talk to, who to turn to. But I saw in the people around me that there was no importance to the topic, and if you don't see the importance, you're not going to invest in the topic. So for me, because it's still a growing area, and there's the worry that people that I want to attend will go, it's not that important to me. I didn't want to have any obstacles to them attending. So finances could be seen as an obstacle, so I've removed them. So there's no reason not to attend.
Yeah, no, definitely. And yeah, I can totally relate to that. Going back to my vet that said he wants to learn nothing about behavior medicine. It is, right? There are still obstacles, barriers, beliefs around it, I guess prejudices around certain areas of veterinary care that are not deemed to be important, like you say, or not real veterinary medicine, when actually they're the glue that hold everything together. So yeah.
I had a really great week this week because I put myself out there to lecture as an external lecturer at different vet schools, and so I was lecturing to 60 students for Harper and Kill, and it was really nice to hear the feedback from the students. It was great to get some cool testimonials, and I found myself saying to them again and again and again, I can assure you it's about communication. You can easily, once your communication skills there, say, do you know what, I'm just going to go remind myself about that. I want to get the latest info before I let any kind of plan come together. Are you okay just waiting here, or let's wrap this up and I'm going to get you back in, or let's get this onto an email? I have no problems doing that because my brain is not an encyclopedia. I am not that person. Too much red wine, probably. But anyway, it doesn't matter. But having good, confident, kind, humble, empathetic communication style is absolutely fundamental to, in my opinion, being a good vet.
Yeah, absolutely. And that's something that I certainly wasn't taught at vet school. And again, that's why, this resurrection of the coaching qualification is like, I don't know, like, why has it taken me so long to figure that one out? It was sitting there dormant all the time.
I'm envious. I want to do coaching.
It's great. It's one of the best things I've done. It was so good. And probably somewhere, subconsciously it's helped me with the team and all that sort of thing. But actually I hadn't made that connection properly to including that into my behavior consultations, which I will now be doing.
Yeah, I love it. Really, really good. And I think, as you say, anything that needs that significant change in mindset, you need to think much bigger project, much bigger investment, not financially, but time and resources and check-ins.
Yes, check-ins, exactly that. And it's that accountability piece, I think, also for some of my clients, certainly, you'll do the initial consultation and yes, initially everybody's on board, but then, a week goes by, 2 weeks go by, and that accountability for what we had agreed was going to be done, isn't perhaps there so much anymore. So it's those regular check-ins to just be like, so how are we getting on with this piece that we talked about? And, were you able to implement any of this yet? And what might be stopping you? And how can we sort of, change that around to make it easier for you? So it's about removing barriers, for those caregivers as well, to be able to do the things that we think are important for their pets' behavioral health.
Yeah. I agree. And I think there's also so much opportunity to experiment and to play in that. What's the possibility, possibly not so much with behavior, but definitely with chronic pain, of having group consultations? I know that speaking to first opinion vets, you do feel sometimes like you're running the hamster wheel, you're being a little bit repetitive, and maybe, you've said the same piece already 3 times that day. And is there a way that we could actually go, right, so I know what I need to tell you is not going to be possible in the next 15 minutes. So we actually have a service where, once a week we have a Zoom group call with all of the OA diagnosis kind of that week. We encourage you to attend. It's convenient to your own home, and we're going to be talking about lifestyle, we're going to be talking about exercise, we're going to be talking about weight management, comfort of your own home. It's free to attend. I just kind of like, there's different ways that we can start doing this.
I love that idea. I'm going to steal that from you.
Oh, let me do it. I want to practice. I just want to play with this
love
idea.
that idea. That's such a brilliant idea, because there's going to be something in there that's going to be relevant to everybody. Maybe not everything's relevant to everybody, but something will be. So I love that idea. That's a great idea.
I just think that we've now got the technology. I don't wish for this to be an AI driven thing. I don't wish to lose the humanity and the care. And I just wonder if there's a way that we can help vets in practice. We can keep clients in the practice. We can meet their needs, make it easy, accessible. And I just think there are different ways that we can do this.
Yeah, no, I totally agree. Totally agree. Work to be done, but I think we're up for it.
Love it. Bring it on.
So we're kind of at the top of time, and we haven't even talked about what we wanted to talk about, but we've talked about so much more and much better stuff that's just kind of come naturally. I think the conversation's just kind of gone where it's gone. And
let's do it again. Let's just make it a thing. Let's have regular chats. It's fine.
No, honestly, and it's so funny. Every time I chat to you, my thoughts expand, and I think differently about certain things. So I absolutely love chatting to you, and I love the synergy that exists between chronic pain and veterinary behavior medicine, and how so many things overlap and how so many things are so similar, and how we can steal ideas from each other. Like I've just stolen your little Zoom group consult idea. But I think and we should definitely have more of these conversations, because I think they're enriching to us. Certainly to me, I can only speak for myself, but certainly very enriching for me. And I think it's going to be hugely enriching for anybody that listens to this podcast. So thank you.
No, not at all. I love it, and love you. I think you're amazing. Very inspiring.
Thank you. Same to you. You're definitely the person I think of when I think of inspirational, strong women.
Don't think accident.
No, that's why I refuse to believe it was an accident.
It was. It was an accident that ruined my life. That's what I keep telling everybody. But no, it's definitely been a journey. And I think when I look back and go, God, this is a bit of a pickle. How did I end up here? I then very quickly think, I have met amazing people. And what I'd really like to do is, let's just hope there's a Netflix producer listening to this, because there's all these dog behavior kind of like series now, dogs behaving badly and stuff. I want to do one about taking pets that have chronic disease, where people are like, oh, this is doom and gloom, and going, look what we can do. And I would love to be like the host and go around showing situations that lead to a program that is just pure inspiration. That's what I want to do.
You need to pitch that to Netflix.
All right, how do I do that then?
We'll figure it out.
Yeah, I think it'd be good. I think it'd be great, and I think the world needs it. It's a bit gloomy at the moment. We need
uplifting stories of hope, and absolutely. No, I totally agree. And on that note, how can people find Cam? Tell us all the places that we can find you. Obviously, I'm going to drop everything in the show notes, links to the website, links to the Facebook groups and so on. But tell us, please, where can we find you guys?
So there's caninearthritis.co.uk. So that's CANINEARTHRITIS. So many people don't know how to spell canine or arthritis. So bringing them together is a total nightmare for many people. So that's caninearthritis.co.uk. Then there's caninearthritisteleguidance.co.uk. There are courses at cameducation.com. So we've got a practitioner course, so for vets and nurses. We've got for our canine professionals, we've got Cam Advocate Level 1. We've got Cam Essentials for the caregivers. So there's lots and lots in there. We've got the Member Zone, which you can get via the Canine Arthritis website. Please do join that. We are still completely self-funded. And our really pathetic business model is that we hope that people want to join our member zone for £35 for the year,
Wow. Yes.
And that involves multiple tea and chats where you get to ask your questions, you get access to member zone special live interviews, you have 500 hours of interviews, CPDs with experts like yourself. So there's that. What else is there? We're on Instagram, Facebook, we've got Holly's Army group, we're on TikTok.
Okay.
I know. Okay. We go to conferences, we like to speak around the world. I'm looking for my next big long haul airfare. New Zealand, anybody there? Australia, I need to pop over. So I'm looking for any teaching opportunities over there. Universities, come on guys, I love teaching students. So if you are persuaded that you need to put a little bit of injection of passion into your chronic pain lectures, give me a ring. So yeah, doing lots.
Perfect. And I can definitely testify to the amazingness of your team training days, which we actually need to do a refresher of in the new year. So yeah, Hannah came and virtually lectured my team for a whole day on chronic pain and arthritis. And I actually remember after the first morning session, I was actually in tears because I was like, really? How have I missed this for all of these years? Just the numbers that you go through and the prevalence of the disease and all of that stuff is quite mind-blowing when you hear it like that. And yeah, it really took me aback, and I really felt like, oh my God, like, really?
Do you know what? I know that practices around the world, if they were to have their eyes as a team opened to how prevalent and how it is under their noses, this is a win-win for everybody. I did a presentation for a company about what's the win for the owner, the dog, the team, and the practice owner, and everybody will win because it is so prevalent, and we are letting these animals come into our care. We're vaccinating, we're checking lumps, we're looking at teeth, and we're completely missing them going, oh, it really hurts, help me. And a definite motivator, and probably like the last thing that I'm going to say, because I'm going to stop rambling. I think every time it gets tough with Cam, because it is tough, I think about all of those dogs that are in homes and the caregiver is saying to themselves, I love him, I love him, I love him. But as they pick up the dog, it hurts and wince. As they look to where their dog is hidden under the table, is in his bed, he doesn't want to walk anymore. And that dog is saying to them, I'm really need your help, but you can't see how much I need your help. So yes, I think that is something very important to me.
Yeah.
So
absolutely.
That's my father. I'm trying to get rid of him.
Right, so we definitely are at the top of the hour or end of time, so we're going to wrap it up here. Honestly, Hannah, thank you as ever for such a great conversation. I love chatting to you, and like I say, my mind is expanded, and yeah, you inspire me. I know you say I inspire you, but you inspire me more. So there you go.
Thank you. That's very, very kind of you, and can't wait till eventually meeting you in person.
Yeah, no, absolutely. And have a few glasses of wine together and put the world to rights.
Perfect.
All right. Thank you, Hannah. And thank you, everybody, for listening. And we'll see you next week for episode 59. Bye.
See you later.